My name's Tracy Dixon and I'm the Director of the Menzies Institute for Medical Research here at the University of Tasmania. And on behalf of myself and Professor James Vickers from the Wicking Dementia Centre, I'd like to warmly welcome everyone in the room and the many, many people who I know are joining us online for this very exciting occasion, the launch of the world first Parkinson's Massive Open Online Course, or MOOC. So before progressing to the program, I'd like to acknowledge that today we are meeting in Nipaluna, Hobart, in our beautiful home, Lutruwita, Tasmania, and that these are Aboriginal lands, seas and waterways. And I'd like to pay my respects to the traditional owners, the Muwinina, and I acknowledge that it's a privilege to stand on country and to walk in their footsteps. I'd also like to give my thanks and acknowledgement to the ongoing custodians of these lands, the Palawa peoples. I recognise their deep connection to our unique island home. So also on behalf of James and I would like to welcome the Honourable Mark Butler, Federal Minister for Health and Aged Care, who's joining us online from Canberra today. Mr Michael Katz and Dr Richard Balanson, founding directors of the Parkinson's Research Foundation and funders of the Parkinson's MOOC. Professor Carolyn Sue, President of the Movement Disorder Society in Australia and New Zealand, and also Chair of the National Parkinson's Alliance. Professor Rufus Black, the Vice-Chancellor from the University of Tasmania. Professor Graham Zosky, Deputy Vice-Chancellor Health at the University. Panel members, Professor Michelle Calisea, Mr Michael White and Dr Harley Stanton. I'd like to also extend my welcome to the many contributors to the MOOC that we have in the room and online, to Menzies and Wicking donors and supporters, and also, and last but certainly not least, my warmest welcome to the Parkinson's community. People living with Parkinson's, their carers, their family members, their health professionals, the broader community across the state, nationally and internationally. We have a packed program. So the first part of our formalities today is a panel discussion. So I'd like to launch our launch by inviting Professor Michelle Calisea, Dr Harley Stanton and Michael White, who have so generously agreed to share with us a moment of reflection and insight from their own Parkinson's journey and perspective. So Michelle, Michael and Harley, if you'd like to join me over.
Thank you so much for joining us today in this panel discussion. Obviously, for the MOOC launch, people with lived experience with Parkinson's are at the heart of the MOOC and at the heart of the research that we do here at Menzies and at Wicking. So, Michelle, I was wondering if you wouldn't mind if you could tell us a little bit about your Parkinson's story, particularly your diagnosis, what that was like, what helped and what could have helped.
Thanks, Tracy. So I was 48 years old when I had my first symptom. I was a very keen trail runner running down Mount Wellington and felt my left leg just didn't feel right, had some cramps in my toes. I realised it probably even at that time that it wasn't a sports injury. Anyway, it kept happening and I started to get other symptoms like slowness in my leg. It started to drag. I went and saw a physio, I saw a GP, I even saw a neurologist fairly early on and everyone said, no, you're fine. I had lots of tests, everything was fine. But of course, Parkinson's didn't stop. So it progressed into stiffness in my arm, slowness, decreased arm swing, and I started to have a lot of trouble with even walking, typing, pain and concentration at work. And so after seeing many, many people over a 2-year period, I was diagnosed with Parkinson's at the age of 50. And to say it was devastating is probably an understatement. You know, what does that mean? All those plans that you have, it was really hard. And so I think the things that really helped were information. I think knowledge is really power, and it really helps you make decisions with your healthcare provider. So I think the MOOC is going to be fantastic for that. The other things that helped were psychological support, physical activity, and really seeing and meeting other people that I guess were like me, my age, were all things that really helped.
Thanks so much, Michelle. Michael, like everyone with Parkinson's, you've had your own individual story to tell as well. Can you share with us today a little bit about your personal strategies for managing your symptoms of Parkinson's and how you've lived your best life?
Yes, sure. How I've lived my best life. I think I'm here because of the word unique. The thing about Parkinson's is everyone gets a different version, and everyone's solution to that is different. I was diagnosed 20 years ago, and in between now and then, I've tried to live my best life. Back then, the research said that the two things, I suppose. One was that drove me. One was that Parkinson's for young people, such as people who are 50, is often slow and in its development. And the other thing was that there was a risk of the levodopa-induced dyskinesias and so on. And my decision was that I would try to avoid that by managing a drug regime and an exercise regime, put those two together. And the drug regime consisted of using levodopa when I had symptoms and only to the extent that I needed to, which meant that I was under-medicated most of the time, because in order to identify whether I needed more, I had to identify symptoms would come. And then I would say I needed more. Now, I had a neurologist who said, get over it and stop being silly. And I didn't. And over the course of the next 15 years, I think I kept the levodopa to about 60% of the prescribed dose. And I like numbers, and I sat down and worked out recently that it was about 7,500 tablets I didn't take between now and then. The other component of that was about exercise. My wife and I had been intending before diagnosis to get to that point in life where we sold the house, said goodbye to the last of the kids, and took off. And what we were planning to take off in was a boat, and we just needed to buy one and so on. And on reflection, we decided we would go ahead with that plan. And what I found was that living on a moving platform does a lot for your balance. The constant challenge to our core strength was really quite amazing. And I found when I got off the boat and lived off the boat for periods of time, which I did occasionally, I went backwards and relied more on the drugs than I had when I was on the boat. So the boat became a central therapeutic aid, which I recommend the government provide to anyone with Parkinson's. But in lieu of that, I think what my point is that I wanted to say that we don't live on a boat anymore. We lived on it for 7 years. I think I skippered the boat around the world 18,000 miles and survived. And it's time to come off the boat. So we've done that. And I've replaced the boat with an exercise program. I spend an hour each morning doing the exercises, which is a pain, but I know that if I don't, then the symptoms come back. My ex-neurologist would be very pleased. I now have the drugs all the time, but that's because of need. So I guess I'm here to say that everyone is unique. No, everyone's solution is unique. Mine is quite unique and not recommended necessarily, but effective. And we all, as Parkinson's sufferers, we all have to work out our own solution. That was mine. And 20 years later, I'm still going. So thank you.
Thanks so much, Michael. Harley, we were talking before, it only seems like yesterday, but you and I met a couple of years ago, and you came with this idea of how do we do more for Parkinson's people and their carers and families? How do we do more together? So I've witnessed firsthand your fierce advocacy at a local, a national and an international level. Would you mind sharing with us your motivation to be so involved and a little bit about your Parkinson's story?
Thanks, Tracy. In 2021, I went to an island project. We retired to Tasmania a few years earlier, and I thought, well, dementia is not something anybody wants to do. And they have one of the largest dementia projects in the world here at the UTAS Wicking Centre. About 14,000 people in Tasmania joined. And so I went along to that, and I went to a TAS test program out at UTAS Mowbray and met a man by the name of Andy Williams. And I said to him at the end of the program, what are you doing about, you're doing a lot about dementia, what are you doing about Parkinson's? He said, not much. He said, contact Jane Alty. I contacted Jane Alty, and the rest is history. Honestly, in 2021, in November, we met 7 people here at the Menzies Centre in Hobart. And that Wings for Parkinson's, at the end of that session, Dr. Nicholson, who's my neurologist, said, well, this is our fledgling group. And I said, I don't want it to be fledgling, I want it to have wings. So we've formed Wings for Parkinson's. It's grown to be a specific interest group of about 33 people. And those 33 people have changed not only Tasmania, but Australia. And now with the help of Rich and Mike, I think they're beginning to change the world. And so we formed that group, and that's actually led to the National Parkinson's Alliance, which we formed about 18 months ago. And the Parkinson's Alliance has actually made a submission early 2024 to the national budget, and they gave us $400,000 to develop a National Parkinson's Action Plan. We had a summit meeting in Canberra with Senator Billick and Senator Askew, and so the senators and Senator Miss Bridget Archer also helped us as well along the line. So this sort of cascade of assistance has come to a culmination today, and I think this is a wonderful day for Tasmania, for Australia, and for the world. I see it as a journey of hope, a journey where we've got a narrative of hope in the course that's being produced, and those that have produced the course have done a superb job. Working with Jane and Michelle, we've just had a fabulous journey, and I can't tell you the serendipity that's happened in my life as a result of Parkinson's. I don't enjoy the stress and I don't enjoy the shake that I've got, but I do enjoy the journey and the people that I've met. And I think it's a wonderful day, not only for Australia, but for the world. Thank you.
Thank you so much, Michelle, Michael and Harley.
Okay.
I'd now like to welcome our Vice-Chancellor, Professor Rufus Black, to join me to speak on behalf of the University of Tasmania. Thank you, Rufus.
Today, for us as a university, this is a significant day. As a university, we are committed to making an impact at scale, to be able to make contributions to Tasmania and from Tasmania that make a difference that's measurable, that changes trajectories. But we know that that only happens when a whole series of core ingredients come together. And this kind of today, in lots of ways, this launch embodies them. We know that it starts with lived experience. That if we are going to be able to do that, the very beginning place are the lives and stories and individual passions and concerns of people in and involved in the communities where change is needed. Change from within is infinitely more powerful than change from outside, because change actually goes to the core of the realities that actually need addressing. And that's the sense we got from the conversation this morning, that it actually has to start with what the real needs and the diversity looks like when it comes to all of what the kind of change is we want to do. That's why we start with the conversation today. But we also know it happens with partnerships, that what makes real change happen is partnerships. Partnerships between those involved in the communities affected, partnerships with people with ambitions to see change, partnerships with governments, partnerships with the knowledge creators, partnerships with the professions, unless they all come together, and ultimately partnerships with our broader community whose knowledge and understanding we know has to grow and expand if we're going to make a difference. Unless all of that comes together, real change doesn't happen. And so today you hear that. But none of that happens if that's a second ingredient. The third is ambition. And what you heard today already, and I think you'll hear a lot more of it, is serious ambition. Because I think when you're going to mobilise the energy and resources to make a difference, it can't be in small steps. It has to be with the kind of ambition that says it's not just something we want to change here or nationally, it's something we want to change globally. That kind of ambition has been clearly at the core of this, and you heard it directly a moment ago, and you'll keep hearing it through all that this is about. Indeed, the very nature of this project as a MOOC, the first word tells you about ambition, massive, open for everybody, online, available everywhere, and of course it is a course, but the first three letters speak to the ambition here, about what the real intent here is, which is to make a very substantial difference, but of course from the lived experience in partnership, but it really does have that at its core. But the kind of fourth piece, and this is where universities play a critical role, is deep expert knowledge really does matter. We know that providing the best available knowledge from the best people is actually vital in the kind of world that we live in today. And what this does is to democratise that knowledge and put it in the hands of everyone who can make good use of it. And that, I think, is the power of what universities do at their best, which is to find the new frontiers and make sure that is as widely shared as possible. And what we've learned from our Dementia MOOC and our MS MOOC is the power of that kind of way of taking the cutting edge and sharing it with everyone who can make use of it, and thinking deeply about what it is to provide that knowledge in ways that actually enables people to take greater charge and greater control of their own circumstances, whether as somebody with Parkinson's or as a member of the community, or indeed quite often as care professionals who realise there's a lot of extra knowledge they're still not across, or a perspective on it that they're not yet fully across, that actually changes their practice as people providing that kind of level of professional care. So today you see all of those ingredients. And as a university, we are deeply grateful to Michael, to Richard, to funders, but also to government, to colleagues, for bringing all those ingredients together and really being passionate about it. I had a meeting a little before Christmas where the just passion and determination that we hit a time frame we'd never hit before, we've never done one of these in as short a period of time, that actually galvanises and changes us in ways I really welcome and we welcome. It helps us find new and innovative ways of getting things done and delivering at pace, at scale. So one of the other things that you'll hear embedded today is just how much actually when you have all of those ingredients at work with that level of ambition and some push, you can get next level innovation that again gets the best knowledge faster, quicker, in more people's hands sooner than before. And we're grateful for that as well. So it's a real privilege for the university to be just a part, but an important part of what this is all about, and to look forward to seeing those values and elements that make this kind of project successful. And this is sort of number 3 for us in lots of ways, being able to be at the heart of that. And I thank everyone involved for everything that has brought us to today. And we as a university share your ambition for the difference this can make for the whole Parkinson's community and the community beyond, who need to come to understand it, embrace it, support it as they have with other illnesses, so we can genuinely transform outcomes for everyone touched by Parkinson's. Thank you.
Thanks so much, Rufus. Our next speaker this morning is Michael Katz. Michael is one of the founding directors of the Parkinson's Foundation, and together with co-founder Dr. Richard Balanson has been a driving force behind the project. And as Rufus hinted at, they've kept us on our toes. They have challenged us to think differently, to think about what we can do and achieve together when we turn our efforts collectively to the one mission. So I thank you both for this collaboration. It's been incredibly stimulating, gratifying, and all of the things have been proven to be true. We did make it to today. We could do it. And so thank you for your faith in us, and thank you for the trust that you've put into us for delivering this MOOC. So Michael.
Thank you, Tracy. Thank you, Vice-Chancellor. Thank you, everyone, for coming. It's terrific to be down in Tasmania. We love it. Best cherries in the world. Parkinson's is a key disease which is so badly understood. And a MOOC is clearly a terrific vehicle for providing a deep understanding at a tertiary level of the huge complexity of this disease. And guess what? UTAS is a global centre of excellence in developing MOOCs. We had no idea when we first came to this university that that was the case. But as soon as it became apparent, we were very, very excited. When Tracy or James said, we have 2 MOOCs in the top 10 in the world, we asked them to repeat it a couple of times because we didn't really believe it, but then they showed us, and it's true, top 10 in the world. There aren't many things in Australia that are top 10 in the world, so that if we have something here that is top 10 in the world, we just had to get into it, and so that's why we're here. Secondly, a key part of our decision-making process is to look at the people we're dealing with, and we identified very quickly that there was real talent in the team that produces these MOOCs. And Michelle, Jane, Emily, Chris, James and Tracy, of course, exhibit some of the things that we look for. They look at, and Sam, sorry, I missed it there. They deliver the characteristics that we look for in talent. And those, of the many, the 3 that I always focus on are, you have to be smart, you have to have resilience. Emily, who plays football, netball and every other sport under the sun, has resilience, we know that. And thirdly, they have to understand the need for speed. It's not something that everybody does, but we saw it in this team, and they responded so positively to the idea that we could do it in half the time for half the money. So making things happen at speed was what we saw was possible, and hence it took us at least 30 minutes to take the decision to help to fund this wonderful project. There is a shared vision here to build a global community of Parkinson's people, that is both carers, people with the disease like my poor wife, Frederick over there, who has to put up with me but also has the disease, which is probably a little bit less bad. A global community of folk committed to making progress on PD. And that progress has to be sustainable, it has to be interactive, and it has to be objective. It has to be scientifically proven. And we think this is the basis for a lot of work that can come ahead, which will be so exciting in achieving that sort of vision in a very quick time. So we established this foundation, the Parkinson's Research Foundation, and another organisation called Myriax, which does venture philanthropy. And we are just honoured to be able to fund and to help the development of the MOOC. If we can provide some inspiration, some project management, to see this sort of project come to fruition, that is the greatest thing for us. And so we're absolutely thrilled to be down here, enjoying the cherries and enjoying your company. Thank you very much.
Thanks so much, Michael. Now it gives me great pleasure to introduce and ask to the stage Professor Jane Alty, neurologist and researcher from the Wicking Dementia Centre, and Professor Michelle Calisea, physiotherapist and researcher from the Menzies Institute, who are joint academic leads of the Parkinson's MOOC, to share with us a little more information about the process of creating the MOOC and the need that it has filled for the Parkinson's community. So thanks, Michelle and Jane.
Thank you, Tracy. Thank you, Vice-Chancellor. My name's Jane Alty, and it gives me great pleasure to welcome you all here to the launch. I can hardly believe we're here. A lot of work has gone into it. And Michelle and I are going to be talking a bit about the development of the Parkinson's MOOC. So, as I mentioned, my name's Jane. I'm a neurologist, a neurology doctor at the Royal Hobart Hospital, and I'm also a researcher here at the university. I came from the UK about 6 years ago to work here in Tasmania, and in my clinical work in both the UK and here in Australia, I've walked a path with hundreds, if not thousands, of people with Parkinson's. I specialise in Parkinson's, and I hope I bring some of those experiences to the MOOC. I'd like to introduce my co-lead, Michelle.
Hi, I'm Michelle. You've already met me, but I also have a background in physiotherapy. I also worked at the Royal Hobart Hospital with people with neurological conditions for most of my 20-year clinical career.
Thank you, Michelle. And we also get on, we're friends, and I think it's fun if you work with your friends. So there's been some really enjoyable and stressful moments making this MOOC. I think you all now know what is a MOOC. I have to say I didn't know that before I came to Tasmania. And I've learnt a lot in that journey since moving here. So as you've already heard, massive, I think that's the key word. This is global. We made this in Tasmania and we're taking it to the world. And that's a key point, that it's free, that it does not cost people any money. It costs them their time, but no money. And that takes away a huge barrier. And what it means is if you have a computer, be it a laptop or a smartphone or an iPad or any kind of computer device, and you have access to the internet, you can do the MOOC. And that's huge, isn't it? Because it means people can do the MOOC on the bus, or they can do it at home. They can spend a few hours on it or spend a few minutes on it. So it's very much self-paced for you, anywhere, anytime. And that's a very powerful tool. What it means is that people out in rural and remote communities can do it, just as people in cities. It's giving an equity to education. It's taking away those barriers of transport and money. And that's very exciting because it now means we have a tool that can truly go global. And as I say, we've made some fantastic MOOCs here that have done exactly that. This Parkinson's MOOC is building on a legacy of highly successful MOOCs that have been produced by the university. The Understanding Dementia MOOC was launched about 10 years ago, and as you've heard, it's become extraordinarily successful. It's been used by people across 240 countries in the world. We've had about 800,000 enrolments for these MOOCs. But what's really important is not those numbers, it's what do people think of them. And as you've heard, they're in the top 10. So I think we have confidence that we know how to make a MOOC. And when I heard that, when I came to Tasmania, I thought, what if all of those hundreds, if not thousands of people that I've seen in clinics, what if they could access the MOOC? What if we could take some of what happens in the clinic to the people, particularly people who might not be able to access a neurologist, might not be able to access a university? And I think as well as education, I wanted to bring something else to this MOOC. I wanted to bring compassion. You see, as a doctor, when I'm sitting opposite somebody with Parkinson's, it can be a very emotional time. It can bring something that's very vulnerable. Things are said in consultation rooms that are not said anywhere else. And I thought, I've walked this path with so many people. I've heard the same themes of loss and sadness and shock at the diagnosis, but also hope and resilience and some humour too. as you go through those years. And one of the things that came out really strongly to me is that people who live well with Parkinson's, there's a common element, and it's that they've met somebody else. They've met somebody else with Parkinson's. And that's why in this MOOC, I wanted to bring the voice of people with Parkinson's right to the core, right to the nugget of this MOOC. We have the experts, we have the researchers and everybody else around, but the true experts are those that live with Parkinson's. And in this MOOC, you will hear those voices. And I've done that purposefully so people don't feel alone. And I want people to feel something when they do this MOOC, not just remember the facts and figures. So how did we make it happen? How did we go from that idea? Well, you've met Harley. Harley gets things done. Harley doesn't give up. Harley emailed me and said, Jane, we need to do more in Tasmania. And you've heard about this little group. A group of us from the hospital and the university formed. And within a year, that was 35 of us, people with Parkinson's across the community. And then Michelle and I started to work together. I heard some of Michelle's personal story as well as her academic prowess. And we started to realise we could do great things together, working with the community. And believe it or not, it was just 1 year in this room, we held a Parkinson's symposium. And over 200 people were here. We had about a few hundred online. There was a real hunger, a real need to learn more about Parkinson's. And somebody in the room, I don't know who it was, said, are you going to make a Parkinson's MOOC? And tentatively, we said yes. But afterwards, we said, where is that funding going to come from? And I'll hand over to Michelle at that point.
So it's incredible to think that it's actually just less than a year ago that we were first introduced to Michael and Rich. And personally, we'd really love to thank you in behalf of the university and also the Parkinson's community for not just your generosity, but your vision and the expertise that you've really brought to this MOOC to make it a world-leading MOOC. We really thank you for that. So we made the MOOC and we've had already 10,000 people across the globe interested in this MOOC. There are 5 modules, as you can see here. The first module is really an overview of what's to come. So if you already know about Parkinson's, it's a recap, and each module will go into more depth about every topic. This MOOC was really made in Tasmania, Australia, to the world. We interviewed over 86 contributors from 6 continents, and you can see here we've got professionals from allied health professionals, neurologists, nurses, people living with Parkinson's and their family, and we really thank everybody for their contribution. We were able to interview people in person at different international and national conferences that particularly Jane went to, as well as over Zoom, to really get the best experts and people with lived experience for you to listen to. Jane and I have worked clinically for many, many years with people with progressive neurological conditions, and we've educated health professionals and also people about the condition. And Jane once, when I was first diagnosed, told me the story or the analogy of the bathtub. And this just explains how the medications work. And I thought, gosh, Jane, you're from Britain. That's very British, being a bathtub. But it was lovely to bring this story to life in an animation. And we're just going to play it for you now, just so that you can see how we've changed some of these stories for you.
Imagine your brain as a bathtub that needs to be filled with a special fluid called dopamine. In Parkinson's disease, the bathtub isn't filling up properly because the brain isn't producing enough dopamine. Without medication, dopamine levels in the brain are too low, disrupting the normal functions of dopaminergic neurons. Remember, these are the cells in the brain that contain, produce, and release dopamine. Medications for Parkinson's work in different ways to restore that dopamine balance. Levodopa enters the brain and is converted into dopamine, which replenishes the lost dopamine levels in the brain. Agonists mimic the effects and functions of dopamine. Inhibitors slow down the breakdown and use of dopamine, which helps to maintain its levels for longer. With the right medication, dopamine levels are adequately restored, helping to manage Parkinson's symptoms.
So you'll see that we've really tried to make this interactive. There are quizzes, and you will hear the personal stories of people living with Parkinson's. So why do I think this MOOC is really important? Well, when I was diagnosed, I was a health professional, but I really had no idea what it was like to live with a progressive neurological condition. What did that mean? And I really did not see people like me. But I think what's really I love about this MOOC is that it doesn't matter where you live. You will hear from people living with the condition, and hopefully you will see somebody like you. In addition, I wanted to know as much as I possibly could about Parkinson's, and I was so lucky to have medical colleagues as friends, and I asked so many questions. Should I start the medications now? How can I improve my sleep? I probably annoyed them a lot. But the great thing about this MOOC is you'll be able to hear from experts all around the world to answer your questions. If you're a health professional, what will you learn? Well, if you don't know a lot about the disease, you will learn about how to manage it, the biology. But I think what is really unique is that it's not just what you will hear in the clinic. It'll be like talking to a friend who's living with Parkinson's disease. How does it really feel to have the condition? And I really hope that helps to improve practice. Additionally, I think the MOOC is really going to raise awareness, not just about it's young, you can be young to have Parkinson's disease, all those non-motor symptoms that are really not talked about enough that really impact on people's quality of life. And what I really hope that this awareness also increases research to improve care and also to hopefully find a cure. Finally, I'd just like to say an enormous thank you to the project team. Sam and Em, you've put your heart and soul into this and worked so hard. Thank you so much. To Chris and Bruce through IT services, all the videos and the filming that's been done, it's been absolutely fantastic. To Professor Alastair Noyce, who's been our external reviewer and contributor, a very well-known neurologist from the UK, thank you. And particularly to Trace and James for your support. It's been absolutely fantastic. And I'd personally like to just say how much of a privilege it's been to work with Jane. She's an exceptional clinician, researcher and educator, and it's been a fantastic journey, so thank you.
Thank you so much, Jane and Michelle. I couldn't be more proud to think about the talent that we have at our university working with us to solve these big problems collaboratively and together. You both are exceptional researchers and people, and I've really loved working on this project with both of you. Thank you for your leadership. It now gives me great pleasure, hopefully with wonderful. Our final speaker today, I'd like to introduce is the Honourable Mark Butler, Federal Minister for Health and Aged Care, who's joining us online from Canberra today to officially launch the MOOC.
Welcome, Minister Butler. Thank you for being with us, and I'll now hand over to you.
Well, thank you so much. Hopefully my IT is working and you can hear me. It's such a great pleasure to join you here from Ngunnawal and Ngambri country here in Canberra. As you probably know, the Parliament is sitting for a fortnight, which is where I'm joining you from. But I want to acknowledge the traditional owners of these Canberra lands, the Ngunnawal and Ngambri people, and also pay respects not just to their elders, but to the elders of all the various lands where everyone participating in this hookup are today. I really want to thank you for inviting me to say a few words to this exciting launch. It really is a great pleasure. As you know more than me, Parkinson's is the second most prevalent and fastest growing chronic neurodegenerative disease across the planet. And here in Australia, around 150,000 Australians are living with Parkinson's. And obviously, this number is going to increase as the population continues to age. as well as causing great distress and dislocation to people with the disease and their families. We also know it costs the Australian economy around $10 billion every single year. The causes of Parkinson's, in spite of it being a disease known to us for so many years, are still largely unknown, and a diagnosis remains very difficult for those who are living with it, and it takes time. And right now, we know there's no cure, but we do rely on medicines and other health interventions to help reduce symptoms and to improve the quality of life of our fellow Australians. But we also rely on people to research and study this disease and to continue to strive for that cure that we all want to see. And for this reason, it really is a great pleasure to be here with the University of Tasmania, launching a first of its kind massive open online course, or as I heard the previous speakers describe it, a MOOC, to support literally millions of people living with Parkinson's globally. The Parkinson's MOOC was developed by a centre I know very well and have worked with for many, many years, the University of Tasmania's Wicking Centre for Dementia Research and Education, as well as the well-known Menzies Institute for Medical Research down in Hobart. And it consolidates the latest information about this disease from leaders right across the world. This is such an important tool for people learning about this disease, who are studying this disease, who are investigating the diagnosis, the treatment and the care of people who live with the disease. And I want to thank in particular Professor Michelle Calisaya and Professor Jane Alty in partnership with the university for their leadership and for getting this MOOC up and running. I also want to thank Parkinson's Research Australia and the National Parkinson's Alliance, which brings together all of the terrific patient organisations, researchers and clinicians across Australia who are contributing to making this course a reality. It's going to really be a game changer, I think, for people with Parkinson's, their carers, the healthcare professionals, support workers, researchers, and health policy makers like me. Anyone with an interest can jump online. It's free, it's accessible, it's self-paced, and it's really good for busy people. Importantly, it's also going to provide opportunities to connect with other people who are interested in Parkinson's in Australia, but also right around the world. I want to talk about a couple of things that our government is doing to reduce the burden of chronic conditions generally, but Parkinson's disease in particular. One of the things that we've been particularly focused on is making sure that medicines are cheaper, particularly medicines that people rely on week in, week out, month in, month out, and often for the rest of their lives. As you probably know, over the past couple of years, we have been introducing a number of medicines that are able to be prescribed for 60 days supply, halving the number of times patients need to go to their pharmacy, halving the number of times hopefully you need to visit a GP just for a routine repeat script, and also obviously saving money. As you know, there are several medicines listed on the PBS for the treatment of Parkinson's, and I'm really pleased to say that every single one of them is now available for a 60-day script. Look, we've introduced a range of cheaper medicines policies because we found that too many Australians were going without a medicine that their doctor had said was important for their health because of cost of living pressures. You know, those pressures have been particularly acute over recent years, and we're hearing too many stories of people having to choose between household staples, paying their energy bill, buying groceries on the one hand, or filling those scripts that are so important to their health. The government's also investing in a once-in-a-generation transformation of health and medical research in Australia, doing that in close partnership with our terrific collection of health and medical researchers in Australia, including at some of those institutions I talked about who are contributing to this MOOC effort. As you know, we don't rank in the top 50 as a country in terms of population around the world, but we consistently rank in the top 10 in terms of our contribution to global health and medical research. Right now, probably at around number 7. And from 2015 to late last year, the New Medical Research Future Fund had invested in a range of projects to further our understanding of Parkinson's disease, and you will be familiar with a number of them. This research is genuinely world-leading, and these projects have the potential to be game changers that will lead to advances in diagnosis, in treatment, and so importantly, in outcomes and the quality of life for Australians living with Parkinson's disease here and around the world. Our government's also really pleased to support your efforts by investing in projects that right now are going to help people living with neurological conditions like Parkinson's. We've provided money for the movement disorder nurse specialist pilot. We know that tapping into those skills and the compassion of our terrific nurses can make an enormous difference to a patient's quality of life. This is going to help improve access to specialised nursing care, particularly in regional communities where that access to care is so much more difficult than in our big cities. And in the last budget, around $800,000 went to Parkinson's Australia for a general practitioner education program. We've got to increase the awareness and the understanding of this condition among our GPs so that we can shorten that diagnosis time and quicken or expedite the access that people diagnosed with Parkinson's get to that specialist support and treatment. The work we do to learn more about Parkinson's and to discover a better way to diagnose, treat, and then hopefully find a cure for this condition simply doesn't happen, as you know, in a vacuum. It takes experts. It takes the ability to tap into those with lived experience. And it takes a community like the one that you are bringing together through this terrific initiative. It also takes focus, though, and determination to make things better. In this case, make things better for people who are living with Parkinson's now and into the future. I really want to wish you all the very best. I'm so glad I was able to join you for a short moment from our time here in Parliament in Canberra. And I'm really looking forward to hearing more about the course and the uptake over coming months. Thank you very much.
Thank you, Minister Butler. We really appreciate you being with us today, and we hope that we will see you as one of the 10,000 expressions of interest for our Parkinson's MOOC, and we look forward to your continued support of our work here. Before we continue with the program this morning, we are going to have a short reel of a bit of an insight into the MOOC and to show you a bit of a snapshot of the content and some testimonials. So sit back and enjoy. We're going to play the movie and then we'll move to the thank you part of the agenda.
Parkinson's exists all over the world and can affect men and women of all ages. When you hear the term Parkinson's, you might think of well-known figures like Michael J. Fox, Ozzy Osbourne or Billy Connolly. But these more common examples of older white males don't capture the full picture of who is affected by this disease. Across the globe, the prevalence of Parkinson's, how many people live with the disease at any one time, is on the rise. From bustling cities to remote regions, no part of the world is untouched by this condition. In reality, Parkinson's impacts people from all walks of life across every continent. While many are diagnosed after the age of 50, younger people can also face this challenge, and the numbers are growing. But importantly, this also means that large communities are coming together to learn more about Parkinson's and to take part in research.
Welcome to the Parkinson's MOOC. If you were diagnosed with Parkinson's disease like I was 3 years ago and you want to know more, this MOOC is for you. If you're a family member and you want to better support the person living with the disease, then again, you're going to learn a lot in this MOOC. Maybe you're a health professional and you want to better support the person to continue the things that they would like to do. This MOOC is going to teach you how to do that.
When we come together as doctors like me, with researchers and with people who are living with Parkinson's, we really can do great things. We can learn more effectively and we can better support and manage the experience of Parkinson's. And importantly, we can also boost research into how we treat and ultimately cure this disease. Together, we really can change the course of Parkinson's. So this course has 5 modules, and each one is designed to deepen your understanding of Parkinson's disease and how it impacts lives. The course has been created together with people with Parkinson's from around the world, alongside their families and friends, doctors, allied health professionals, researchers, and many other voices from the Parkinson's community.
When I was first seen by my GP, he then referred me to the neurologist, and I had a clinical nurse consultant come, and she was very helpful, extremely helpful, and she went through some of the issues in relation to Parkinson's. And it still didn't make it much easier for a time. Then the neurologist did the clinical tests and said, you know, I'm a person with Parkinson's. And I think that, you know, over time, I guess some people find it really challenging when that happened. One of my friends that I go to the PD Warriors with, she said she cried for 3 weeks when she was diagnosed. And I find that sad, because it's partly related to the individual situation and partly related to the perception that people have of the way in which society views Parkinson's. And I think that's something that needs to change significantly.
Before my husband and my mother were diagnosed with Parkinson's, I don't think I really had much idea at all. I just thought it was, you know, an old man shaking disease. And then my husband and my mother have it, so I didn't have much experience, but I kind of didn't have a very positive outlook about it, to be honest.
Because I'm someone who likes to know things, I actually did some research through Dr. Google and found that interesting, but didn't really click at that point. I would suggest the need to find out as much as you can about the disease, its effects, because its effects aren't just physical, they would also be mental.
Hi, my name is Bas Bloem. I'm a professor of neurology at the Radboud University Medical Center in Nijmegen, the Netherlands, and the director of the Center of Excellence there. I am very excited that you are launching a new global Parkinson course for many reasons. And one of those is that, unfortunately, Parkinson's disease is the world's fastest growing neurodegenerative condition.
So Parkinson's is a lifelong condition, but one that is treatable and one that a person can live well with. It doesn't need to define who you are. You are still you, with or without Parkinson's. But by learning more about Parkinson's and the risk factors and how to manage the symptoms, and supporting ongoing research, together as a community we can really make a difference. So let's walk on this journey together.
Hi, I'm Kuhan. I'm the co-host of the Parkinson's podcast, Two Parkies in a Pod. And I'm also the creator of the Parkinson's On app. And if it's not already obvious, I'm also a person living with the condition. And I guess that's kind of the point. To many, I'm not the typical face and voice of somebody with Parkinson's. But sadly, it's a condition that tends not to discriminate, impacting people of all ages, genders and cultures. It's a complex condition, and while numbers have doubled in the last 20 or so years, what makes Parkinson's a particular challenge is that we all have our own unique version of it. That's why growing awareness and education is crucial, and why this course is so helpful. Thank you.
I'm Michael Oken. I'm at the University of Florida. I'm a neurologist, and I'm totally dedicated to this Parkinson's journey. And I believe that together we can create a plan and we can create the education that's going to change the course for this generation and the next. So I hope that you all enjoy, enroll, tell your friends, your family, and we spread the word and we help each other, because a journey is together. There were no roads until people walked on them. And we're inviting you in this course to walk on this road with us, to learn about Parkinson, to shine a light on this disease, and to help us to promote a better future for this generation and for the next.
I found myself getting a little teary actually through that. What a beautiful reflection on the power of this MOOC. So thank you. So we are going to transition now to the end of our launch and do a little bit of thanking. So I'd like to invite Michael back up onto the stage to thank some of our colleagues.
Thanks again, Tracy. Look, it's been, as I said earlier, a real privilege to be involved in this, but the real thanks go to the people who've done the hard yards, as they say in America. And, you know, it starts with Jane and Michelle, it includes Emily and Sam, and we just thought a small token of our appreciation would be appropriate. Anyway, we thank you all. You've put in hours and hours. It's fantastic. We really are thrilled. And, you know, this is just a very small token, but a very important one, because you are the real drivers of this particular event, and without you, we wouldn't have got here. So thanks very, very much, and we look forward to seeing this thing grow, as we've described, into a global, universal, not a solution, it's not a solution, but it is a development, as Professor Oaken said, of a community of people who will travel together. And with our, you know, we're in the world of big data. So if there's enough of us and we all contribute our data, we will find somewhere in that data some solutions which will actually make real progress. So thank you all, and over to you.
Thanks,
Tracy.
Thanks, Michael. So as you have heard today, the Parkinson's MOOC aims to provide comprehensive knowledge and insights into Parkinson's disease, the fastest growing neurological condition globally. It's really been purposefully designed to empower individuals living with Parkinson's disease, their support networks, healthcare professionals, and the global community. So on behalf of the entire Parkinson's MOOC team at Wicking and Menzies and our partners, the Parkinson's Research Foundation, we thank you for attending the launch today and for your support. And really, I guess I'd like to just thank everybody for your attendance here today, everybody who's attended online, those 10,000 people who have already expressed an interest in doing our Parkinson's MOOC. We're really overwhelmed by the enormous support that we've already received. Thank you to the Wicking and Menzies support teams, particularly Claire and Kat. Events like today don't happen without their amazing contributions, and we thank them for that. And finally, as I said, if you've not already joined up, please join us on the Parkinson's MOOC. There won't be an exam at the end. We won't publicise our results, but we can take this journey together and really make a difference for everyone living with Parkinson's. So thank you so much for being here. We really welcome you, and thank you for your support.